Today, I am chatting with Giorgia, and she is all the way in Australia, Bondi Beach. She's 5 weeks postpartum after an unplanned cesarean birth. She's a push prep student, and she also dealt with very severe hyperemesis. So basically, feeling nauseous and vomiting her entire pregnancy. So, not just morning sickness. Giorgia, you
No,
have
all,
lots to say. Oh my gosh.
yeah, thanks for having me. Great to be here and hi from Australia.
Yeah, and it is 9 a.m. I just dealt with getting the kids at the door and it's 11 p.m. for you. And I was like, wow, this is late. Thanks for speaking with me. And you're like, I'm up every couple hours. What is time? You literally said that. I was like, oh my gosh, I love you.
Exactly. We're between feeds down here in Australia
I,
this evening.
I love it. I love it. Well, thank you again for chatting with us. So I think where's a good place to start? First of all, let me share with you. I've done reels on in the past on like tips for morning sickness. And there's often a lot of, I guess it could probably, I'm imagining, feel annoying when you're told like such basic tips like eat ginger, have small meals, take vitamin B6. You're like, yeah, thanks. I've done all the things. And like, I'm still literally vomiting. I think you said 600 times throughout your pregnancy. So what was that like? What did you do?
Yeah, I mean, it was kind of like a marathon that you sprinted multiple times a day, but you also, couldn't sprint or do a marathon or think about drinking a glass of water. But on the tips, you're right. It's kind of there's so much you can do for nausea, but for hyperemesis, it can be so challenging. But you also want to solve it, right? Like you are willing to try the ginger and you're willing to try the water and the small meals. But it's really tough. Maybe I should just say quickly explain what hyperemesis is. So hyperemesis is a condition that affects about 1% of pregnancies, I think. And the best way to think about it is gastro all day, every day for your entire, well, actually, it can be your entire pregnancy, but it definitely sort of goes beyond the first trimester. And so it's really, really severe nausea and vomiting. They don't really know what causes it. And I sort of bumbled through the first trimester being like, oh yeah, everyone, I'm nauseous and sick like everyone else. I was vomiting about 10 to 15 times a day in the first trimester. And then I sort of got an inkling that maybe it wasn't so normal. And then I want to say like week 21, probably, when I was still vomiting down to only a few times a day at that point. But I sort of buckled in and thought this is going to be probably something I'm going to have to live with for the rest of the pregnancy. And I got it down to vomiting, yeah, still around a couple of days, but a couple of times a day. But I vomited right into my cesarean. Like it literally, it was instant relief when the baby came out, but it was constant right through literally to the minute that I delivered.
Oh, I've got shivers thinking about that. And you also wrote that as soon as the placenta was born with that. So for those of people who don't know, like the placenta is a hormone producing organ essentially. And once it's out of your body, you said it was like instant relief. Like,
Instant, instant.
wow.
So yeah, it was a lot. It was, I would say, as I went to hospital 8 times. So I had to go on a drip to replace the sort of fluids and vitamins and stuff that was leaving. But it was a really, really tough thing to physically go through. But I think the mental, just like knowing that you're going to wake up the next morning and at some point in the day or multiple times in the day, depending where I was at with a pregnancy vomit, was really challenging and really hard for people around me as well. I think that everyone wanted to be helpful, and I could barely keep down a glass of water at multiple times during the pregnancy, but everyone wanted to be helpful and they wanted to provide tips, but it just got to a point where I was like, it was really, really hard to go through, and eating just like lost all of its joy, which is such a shame. But I mean, gosh, eating on the other side is just amazing. It's like I have a new lease on life sort of thing. But I took, there's lots of different sorts of medication that they basically layer and try to help with. And the hospital, I ended up being like a frequent flyer at the hospital and getting to know lots of the doctors and the nurses there, and the IV fluids really helped. And there are a lot of online communities that really supported. And your push prep was the only, I mean, multiple times I had to sort of like press pause and go and have a vomit, but your push prep was like the only exercise I could do through the whole pregnancy, because obviously when you're vomiting that much and you've got so much weight in your on your pelvic floor, your ab separation and your pelvic floor situation is put
The
under a lot of
pressure. Well,
a
yeah,
lot
this is
of pressure.
you're like I have many we actually did a podcast about this with my co-host. This like you're vomiting and peeing your pants at the same time.
Yeah.
Like so you're like, yep, been there, done that, lived it.
Yeah.
Because of the pressure. Like it is a huge blast of pressure on your abdominals, on your pelvic floor. And then it's not like you just do it once, right? Like it's repetitive.
Yeah. Yeah. So I mean, you're kind of just, I saw a physio and I remember her saying to me, look, your pelvic floor situation is going to be a real challenge on the other side. Just do what you can to try and preserve it, basically.
Oh my goodness, so many things. You're like doing everything you can, but there's so much not within your control. So did you do meds, like any type of a medication to help?
Yeah, so I took I'm not sure what it would be called in the US or Canada. In Australia, it's called ondansetron, which is a really, really strong anti-nausea that I was on a few times a day. And then again, in Australia, it's called Restivit, which is like it's actually a sleeping tablet that's also an anti-nausea. So I was on a sleeping tablet 3 times a day. I was awake. You get, when you take a lot of sleeping tablets, you sort of, you get numb to that part of it, but they basically layer, every country has its own protocol, but in Australia they layer the medication until it's always there, but the medication really, really helps. And then the drips and the nutrient sort of replacement's a big part of it. And then obviously you've got the whole other side of the mental health and how you just it's a real challenge trying to look after yourself, but also really honestly connect with the baby and make sure that you're, still feeling really excited about the baby on the other side and the life on the other side, and, getting ready to deal with being a mum for the first time.
Yeah. Did you worry about like feeling weak for labor?
Oh, totally. So I didn't have a really, really clear plan going into labor, but I wanted to make sure that I drank tons and tons of water when I could in the days leading up to it, because I was mostly worried about being dehydrated. And I made sure to sort of put the hospital on notice around the anti-nausea meds, because I knew, or I had a suspicion that labor would make the hyperemesis worse, which it definitely did.
Oh, really?
And so I was basically on IV anti-nausea for the labor from the moment I got admitted.
Oh my God. So you're dealing with contractions and as someone, it's funny, not funny, I shouldn't say that word, but like I remember I have a video it was like a photo my doula took of me like right after vomiting in labor just because of the pain and so I guess for context, like you often will vomit in labor just because your body is like trying to expel everything, right? Like it's very intense, but then to have an underlying additional thing of feeling additionally nauseous. I can only imagine what that felt like.
It's honestly like going into labor knowing that you just got gastro from your kid's kindergarten. That's kind of what it feels like. It's sort of, knowing that you've got gastro, knowing it will pass, but the physical comparison is accurate.
So were you induced? Did you go into labor spontaneously? What happened?
I was overdue. So I ended up being induced. I was having lunch with my in-laws. My husband he was just off work. So he had some wine, which I told him was going to, of course, mean that we were going to go to the hospital. So he'd had some wine with lunch and our in-laws, and we basically had reduced movements that day for the very, very first time. I think the baby was just getting a little bit big and squashed in there. And so we went to the hospital, honestly, not thinking that we were going to go into labor. Like my husband packed the hospital bag, but didn't really tell me he put it in the car. Even though I was almost, I think I was 6 days overdue at that point. It didn't cross my mind that we were going to be induced and go into labor. And we went to the hospital and sort of said we weren't having normal movements. And they basically were like, okay, we're going to work out that your baby's fine. I was like, great. And they're like, by you having the baby. And so it was such a, it's such an Australian sort of like direct way of dealing with it. But
I love it.
I was like, oh gosh. And they sort of like smacked the hospital band on me and they're like, great, you're a patient in the hospital now. And so it felt spontaneous in that way. But no, I was induced. We did the balloon sort of at 9 p.m. at night. And then the next morning they started the drip, and that really got things moving.
Okay, so you did the bulb, the balloon, full. I don't know if you call them a Foley catheter, what you call it.
Exactly.
Yeah. Because they've got different names sometimes depending on where you are. And then, I mean, how did that feel? Because I actually just spoke with someone around their induction story, and they also used Cervidil. So I don't know, because there's so many different ways to ripen the cervix and everything. So how did it feel for the balloon?
I can't say that I loved it. I didn't really have a strong position on the pain medication during labor. I sort of was like, how do you know what you are and are not prepared for, And so I was pretty open-minded about things. But once the balloon went in and I sort of was like, I think I need some morphine. I knew that I was in for a ride over the next couple of days. And so it wasn't like agony, but it was really, for me, it was actually the most uncomfortable part of labor, including the sort of, it was quite unpleasant, I would say, for me.
Yeah. And also just like I said, your nervous system is already overloaded with the nausea piece. Like let's not ignore that. Like that's a huge component here.
Yeah.
And so, okay, so the story, and we're going to get the story straight. So you did the Foley bulb and then started Pitocin the next morning. Okay. And then things ramped up, right?
And it ramped up. I was, it was, I want to say it was slow and steady, but it wasn't really. It isn't labor, is it? It kind of, it kicked off and it felt like things were going to move. I never really knew when we were going to deliver. And so I was always like looking at the clock, trying to guess, like, okay, it's 9 a.m. now. The baby is going to be here by 3. I guess I was just trying to like mentally prepare myself for how many hours of the marathon I had to run. But the drip kicked things off and moved things along. And I thought, in the morning, I thought, you know what, I'm going to ask for an epidural here. I'm already on, I've already got an IV full of anti-nausea meds at this point. I'm going to ask for an epidural. And then I was kind of, we put Ted Lasso on, we put the music on, I really relaxed. I think I fell asleep a couple of times, not like for a long nap, but we just got really into it. And so I didn't end up having the epidural for about 6 hours. And so I kind of labored along without the epidural for what felt like quite a while, right? 6 hours in labor.
Yeah.
That feels like a long time.
It is.
And then basically we got the epidural, and then I was already pretty relaxed, and basically I properly fell asleep once the epidural came in. I was like, I went horizontal, I fell asleep, and then I don't know what happened. I honestly I relaxed, the baby relaxed, I think. And then the midwife came in and was just like to my husband and I, hi Giorgia, hi Grant. A lot of doctors are about to come in the room, and you know what it's like. They basically just like, I want to say 5 doctors sort of swarmed the room, and they were like, hey, we're not sure what's going on. We're just going to watch the monitor. We're going to turn the drip off. But the baby's heart rate's gone down. And it didn't feel scary because there were so many people and they were really on top of it. But Grant and I had basically just one rule going into labor, which was strong opinions loosely held. And we had said that we wanted to be open to wherever the river of labor took us.
Mhm.
And the river of labor was very much taking us towards an unplanned emergency cesarean, but not a sort of run you into the theater emergency.
Mhm.
But a couple of them came in gowns, and they were
Yeah.
like, you should maybe think about moving to a cesarean. But there wasn't a lot of thinking or decision making. It was sort of, you should think about it, but we're going to start to wheel you out the door as
Okay.
we think about it. So yeah, I mean, it wasn't. We didn't have. We obviously didn't have a really, really strong plan, and it didn't throw me that much. I'd already been in labor at that point for probably like close to 9 hours,
Mhm.
plus the induction the night before. And so it just kind of felt like the natural next stage, I suppose. Like it was everything. There wasn't a plan, so things weren't not going to plan.
Yeah.
Um,
Yeah. So
but
you held,
we,
yeah, that's, I mean, how did you feel in that moment when, you use the word swarm the room, right? Like,
yeah, yeah, it became a very full room. Um, I felt, all any mum wants is a safe, at that point, a safe and healthy baby. And I felt like I was very close to getting that. I really, honestly, I was like, I'm about to meet my baby. I didn't know if it was a boy or a girl. I just, the presence of all the doctors made me feel like she was coming, that
yeah.
was the overwhelming feeling. And maybe it's kind of similar to getting ready to push. I haven't done that before. But maybe it's the mental sort of, okay, it's go time. And that's
Mhm.
it very much felt like go time.
Oh, that's awesome. In the sense that I guess I'm hearing a theme of like you already had to be so resilient and overcome so much in your pregnancy for like 10 months basically. You were already overdue, right?
Yeah.
And and then now just this ability to be mentally flexible.
Yeah.
Yeah, it's not easy.
No. No, it's not. And I think I had the extra layer of I thought that the medication that I would be on with a cesarean would probably make my hyperemesis really flare up, which it did. Um, and so I knew I was going to have to really buck up, basically.
So they gave you, you mean right before you're going into the operating room, they gave you more meds that made you vomit more?
Yeah, because they have to up the anesthesia, right?
Sure. Yep.
So they have, yeah, I ended up being on a pretty hectic feeling combination of anti-nausea, but also anesthesia.
Yeah.
I basically just felt really spaced out, was how I
Okay.
felt. And then during the cesarean, unfortunately, I vomited quite a bit, which was pretty tough
Yeah.
when the surgeon's hands are in your stomach.
Oh my
And
God.
that was a lot. But, I don't know. I feel like every woman in labor is just the strongest
Yeah.
version of themselves. And as I lay there, deathly still, but still managing to vomit, I just I was like, I'm in labor. I'm not in the labor that I thought I would be, but so many of the feelings and so many of the experiences are similar. Like, you're at the same time going through something that's really intense, but you're also really close to meeting your baby. And those two feelings
Yeah.
kind of work in tandem to get the baby to you.
I'm like getting emotional
Yeah.
listening to your story. It's true. And you're so vulnerable in that moment. And you're still trying to be so strong.
Mm.
Yeah.
And everyone kind of I remember I remember two very, very clear things happening in that moment, which was I was sort of looking at Grant, and Grant's whole face lit up, and I realized why. And it was because I could hear her. And I I could hear her, and I knew she was close, and I knew we only had a little bit to go. And even though you're not actively pushing, you're not actively doing anything, the act of not doing anything is still a lot in that moment, because you're awake in surgery. I mean, what other in surgery are you awake for? Like, you're fighting a lot of things internally to not do anything.
Yeah.
And so I heard her, I knew she was close to me, and I knew that we just had like one stretch left to go. And then I didn't know if it was a boy or a girl. I was convinced it was a boy. And they kind of like handed her over to me over the drapes, and I got to announce that she was a girl. And even though we were in a theater, and a lot of the medication they give you in a cesarean can make you really cold, in addition to being in a theater. And so even though you're in a theater and it's a sterile environment and you're cold, it was the warmest, most beautiful glow. And I think that cesarean labor is probably really similar to a vaginal birth labor. You know, you're in your own world, and it's just you and the baby, and you've done it together. And yeah, those are the two moments I really, really remember, and they were beautiful.
Oh my gosh. I'm just so happy that you are taking it like this, because I feel like there's probably a lot there could be a lot of people who are like essentially this like scenario where there's so many things that you just straight up didn't have control over, and you had to, it was a constant act of surrender to things and that is true courage, I think. The ability to surrender to the things that you just straight up can't control. It's hard.
Thanks for saying that. No, and it's yeah, that's how it felt. But I do think that we can go in with all the plans we want and all the preferences we want, but we're all driven by the same thing, which is we want a happy and healthy baby. And you put aside your own preferences and whether that's wanting to be in control or having a certain sort of childbirth, and we're women, we get it done.
How's your recovery been?
Well, I can drink water.
Hooray!
I am eating all the things. I'm walking. I'm basically taking it from a point of being quite depleted. Like they sort of diagnose hyperemesis as you dropping below 10% of your pre-birth weight at some point during the pregnancy, and I was pretty under that, and so I have been very, very intentional around rebuilding my reserves nutritionally. And so, you know, food is the foundation for everything. I've really, really been intentional about building up my stores again, and eating what feels good. And then just doing really, really like slow walks. But I exercised, well, pre-pregnancy, I exercised quite a lot. I wasn't able to with a hyperemesis other than your classes. But I am so looking forward to getting back on my Peloton, and I've got my 6-week sort of checkup next week. And I think that's going to be my final stage of the recovery is going to be, I'm not saying I'll be recovered by then, but I'll be on what my path to recovery looks like, which is really looking forward to getting back to exercise.
And you're seeing a pelvic physiotherapist as well?
Yeah. And so I've got, what did she say? I've got the best deep abs anyone after pregnancy gets, because when you vomit that many times, you get some serious abs. But they're currently on the sides of my stomach. So I need to, I'll be doing a lot of sort of stitching movements.
Deep core. Yeah.
You'll be seeing me on the mat.
Okay, I like it. Oh my goodness. So my final question, which I always like to ask anyone sharing their story here, is, well, there's two. It's a two-part question. Number one, what would you say to anyone else currently pregnant, and I'll make this more specific, who is dealing with the same thing that you went through, hyperemesis?
I would say, I think either hyperemesis or really severe morning sickness. You know, that first trimester it's very, very similar. I think that just take it one day at a time. I think that we're all so much stronger than we think we are. And taking it one day at a time just adds up and gets you to the end. And so really not trying to fall into the trap of saying, creating milestones for yourself, or trying to say, when this happens, then that will be over. Just wake up and get through each day, basically. And then I think that, just let that feeling of the placenta being delivered, for me, I knew, because I'd heard so many people say that it was going to get better, but that relief is so real. It does end. So many of the hard things that people go through in this life don't have an endpoint, and they are permanent. And this condition, although it is severe, has an endpoint, which is the most beautiful gift in the world, which is your baby. And so it's like the double whammy of amazingness.
I love that. And my final question, what would you, if you could go back and talk to your pregnant self, what would you say to her?
Oh, well, it's probably going to make me a bit emotional. I would probably be less tough on myself. I think that I used to get, my vomiting and my hyperemesis was sort of down to, I'd vomit once or twice a day, but probably every 10 days or once a week, I'd vomit nonstop for 24 or 36 hours. And that's when I would end up in hospital on the drip. And I so often would say, oh, it's because, I went out late, or I would try and identify a pattern, or I was a bit stressed at work, or I ate something. That would be a classic one, like I shouldn't have eaten that pasta. It was too rich for me. And I think that the cruel thing about so much of the stuff that's out of your control is that we try to internalize that, and we try to sort of attribute a cause to that and apportion blame to something that we've done. And the reality is, with not just with hyperemesis, but so many things that happen in pregnancy, it's out of our control. And so the ride is just so much better if you don't even get into the blame game. Just let it ride, I would say.
Oh, that's huge. Thank you for that.
Yeah.
Show yourself grace. I love it.
Exactly.
Well,
I'm doing a lot of it on the other side. A lot of grace.
Thank you for making the time today, Giorgia, and congratulations on beautiful baby Florence, who is 5 weeks. And yeah, just grateful for you and happy that you've got your baby now.
Thank you. And I'm grateful for you, and thank you for everything you did for me and for your entire community. Thank you.